Hi, my name's Randy, Chief Technology Officer for VDI Laboratory. And being a clinical chemist, I get to talk about my favorite topic again, which is laboratory diagnostics. So it's spring in the air. Here in California, we had a lot of rain. Everything's blooming. And so what do we get with that? We get a lot of watery eyes, runny nose, sneezing, and for our furry friends, a lot of scratching. And so what are we talking about here? We're talking about canine atopic dermatitis, which is characteristic of that is pruritic lesions, which leads to the scratching, which leads to a lot of problems. Now, atopic dermatitis, a key element of it is that it is IgE mediated. This is a key differentiator between atopic-like dermatitis, which is not IgE mediated. And so that's a key distinction and an important one. And when these IgE mediations, a very common one is that you're allergic to environmental allergens, which is why it's often seasonal. In 2010, there was a study that was done looking to see if clinical criteria could be used to help distinguish atopic dermatitis from other types of dermatological lesions. And so Favret and his group looked at these clinical criteria, which are mostly immunological in nature, and developed this key criteria, whereas if you score 5 or more, that there is a high likelihood that the patient has atopic dermatitis. And we're talking about things like early onset of age. We're talking about corticosteroid responsive pruritus, affecting the ear pinna and the front feet, which are often very common. And they ended up with an 85% sensitivity and a 79% specificity, which is really quite good just based on clinical criteria alone. But what you don't know is you don't know what you're actually allergic to. And you can be allergic to a lot of things. You can be allergic certainly to environmental allergens. You can also be allergic to food. You can be allergic to pet dander, such as a cat that happens to live in the household. And so we decided to take a look at what the top 10 allergens actually are. At the top of the list, which might be a little surprising, is the mold mite at 21%. Now, the mold mite, just looking at him, I get an allergic reaction to. This is Tyrophagus. Kind of sounds like sort of like a Roman warrior coming back from the war, you know, Tyrophagus, stand aside, peasants, I'm coming through. And my guess is if you live in Florida, you probably are meeting up with this little guy a lot, being in a humid environment, or you got a leaky faucet underneath the sink, and that is a place where these guys can grow. And if you're allergic to Tyrophagus, you might be allergic to other mites because they share a lot of common antigenic sites. This is through an evolution process, and they have shared protein structures. And so the IgE antibody that is developed against the mite itself, or the byproducts of the mite actually, is ones that are also going to be shared with other mites. And we in fact see that, which means that if you're allergic to the mold mite, you're going to probably be allergic to flower mite, which is the storage mite, and we have 2 dust mites. So 4 of the top 10 in this category here are mites, which is, I think, quite surprising and probably something you didn't know, you know, because we always think of environmental as being so that big thing. And actually, it's changing because the world is changing and mites are becoming a bigger and bigger part. Maybe it's due to global warming. I'm not certain exactly why. But this concept of cross-reactivity is quite important because from an immunological perspective, as we sort of have what's known as hypersensitivity, you could be below the threshold, and then when cumulatively it gets above the threshold, you begin to exhibit signs. No different than seasonal pollen that might come in the air. There still may be pollen in the air, but you're just not reacting to it. But you got to get it below a certain level, and next thing you know, when it's off season, you're not reacting, right? And the same could be true if you got the mold mite, you got some dust mite, and let's say you don't, you know, your house is really clean, you don't have that much dust mite, so you're kind of below the level, but then all of a sudden a lot more dust. It could then lead to a triggering point, and that's very important. Now, if we look at some of the others on this list, and the green are the ones we expect. These are the environmentals like ryegrass, Bermuda grass, orchard timothy grass, and sheep sorrel, which is basically weed. But 2 I didn't expect to see are these foods, and particularly potato and tomato. And so, well, why? Let's do this concept of cross-reactivity. And if you actually look at it, and this is well known, that there's a high corollary coefficient between these things. So if you're allergic to one, you're going to be allergic to the other. because they have shared antigenic sites. From an evolution perspective, even though one's a fruit and one's not, when time began, either due to shared structures or just conformational similarities, either one could actually exist, you can be allergic to it. So in this case, tomato and potato are actually very high, corresponding to these environmental allergens. And this concept of adverse reaction on the human side, which is the oral allergy syndrome, is known as cutaneous adverse reaction to food on the veterinary side, because unlike so humans typically have a GI reaction, and which can happen also in animals, but it tends to be more cutaneous or dermatological in nature. And so this concept, a classic one is birch being, allergic to apple, Timothy grass being allergic to tomato, and so on and so forth, is something that is well known and should be important to you, because if you're going to be allergic to certain things in the environment, there may be certain foods that should be looked at and managed appropriately. Now, with pruritic lesions comes the desire to scratch, and with scratching comes infections. Now, those infections could be primary, secondary, depending upon what's going on. So when you're seeing the animal, if based upon how much history you know or don't know, you might see these infected lesions, and it could be primary because that's all that's going on. It's an infected skin lesion, or it could be secondary to an IgE-mediated reaction. But regardless, it is an infection. That infection could be bacterial, could be fungal, could be both. And so we took a look at, what kind of infections are we talking about? And typically, everybody thinks of it just two: streptococcal and malassezia. But the reality is, and studies confirm this, is that you can be infected with a wide variety of things. The study on the left over here is one of bacteria. Staphylococcus certainly is at the top, but there's also a whole wide range of other bacteria that could be infected in that lesion. And on the right-hand side is different kinds of yeast and fungi, whether it's on the skin or in the ear, because the ear is a nice moist environment, which nice place to propagate. You can see that malassezia is certainly at the top of the list, but my goodness, there's other things in that list: penicillium, aspergillus, and so on. And so we've decided to see what we can do to assist in this area. And this is the area of what we call the Atopy and infection panel. All right. And so the panel consists of two key elements. One is allergy testing. All right. So it is IgE mediated or not. So we're going to actually test for that. We test for 125 allergens, which includes 50 environmental and 72 foods. And more importantly than anything, or in addition to things, is that we actually provide cross-reactivities for you. We'll actually detail this out for you, and I'll show you that in a moment. On the microbiome side, in conjunction with my dog, we were actually identifying bacterial and fungal, both overgrowth of normal flora as well as pathogens. We give you cell count because we can compare that against the normal flora. And further, because we're doing gene sequencing, we can actually tell you what antibiotics the patient may be appropriate or not, because of resistance that may be exhibiting in the microorganisms. Now, anybody that's done work with VDI knows that we are the small volume kings. I mean, my goodness, if you've done any vitamin D testing, for example, you know that we can do it on almost a very small volume, or advanced GI panel, which is like 12 biomarkers we can do on a very small volume of tests, a volume of serum. And so when we look at for allergy testing, we can do on as little as 250 microliters of serum. We have this unique dry technology that you just fill up this well, and it's now stable for 2 weeks at ambient temperature. We use a unique multiplex technology, which allows us to keep this volume small, but also with a high degree of accuracy and automation. Everything's fully automated. On the microbiome side of it, it's just a simple skin swab, which could be on the lesion itself. It could be in the ear. It's also stored in a preservative, which kills everything off, because what we're doing is DNA amplification and sequencing. We're not actually culturing anything. And it is also stable for a very long time. And so everything can then be logistically transported to us in a very cost-effective manner. And with that, you get a lot of information. You get, obviously, you get the what, you know, food and environmental allergens that may be present with atopic dermatitis, as this dashboard would show. Most of them are environmental. And we give them to you by grades, grade 1 being the weakest, grade 2 and grade 3 being the strongest. We'll give them to you by both class as well, so we can tell you whether they're mites or grasses or trees. We can also provide clinical scoring using Favrot's criteria. You can either do this yourself or you can just check it off on the TRF, and then 5 or greater is consistent with canine atopic dermatitis and so on. And on the skin microbiome side, we give you the bacterial fungi ratio because we're actually identifying that. And we'll actually tell you which microorganisms are the one that you need to be focusing on. The report further goes on and gives you quantitative assessments. Now, IgE being an antibody is a titer, which means that during season, titers are going to be high, and out of season, titers are going to be low, or with effective treatment, titers will be actually lower. And so we actually give you titers so that you can then monitor this situation. And I always recommend that patients test when this situation is the worst, because that is when the titers are going to be the highest, so it makes it much clearer, the evidence much clearer. And certainly you don't want to be testing if you've got the patient immunosuppressed with like corticosteroids, because that's going to be suppressing that antibody response, which is what you're trying to do with the steroids, but certainly it's going to affect testing. We give it to you in classes, class 1, 2, and 3s, and 2s and 3s are the ones that are, I would say, the most important. And then, of course, graphically, and you can see in this particular report, insects and mites, and grasses are the big ones, which is going to be expected. Now, we also give you the cutaneous adverse reaction to food diagram or chart. My daughter is very allergic to a lot of things. And so we had her tested. And then it's like, okay, well, there's this oral allergy syndrome. So what food should we, avoid and so on. And so, I got these charts and I'm highlighting and I'm doing all this stuff to try to figure this out. And I thought, why isn't this just being done for me? Why am I doing this? I mean, we got computers, for goodness sake. So when VDI put this together, I insisted that we're going to just provide this and we're going to sort it for you. So anything that the patient is actually positive to is going to be highlighted. And then by color coded. So, reds are higher than yellows, for example. And then we're going to just sort it. So basically on the food side over here, we're just going to sort from high to low, most reactive to least reactive, as to things that you should be looking at. And this is something then as part of our report. And further, we're actually going to provide all cross-reactivities for anything that the patient happened to be responsive to, so that you can look at it and see what might be appropriate. Because there's a lot of things that we don't know that you know about this patient, their environment, their food, there are all sorts of things that then might trigger something for you to then manage. On the microbiome side, we'll actually tell you bacterial species that have been identified. Since we know we're doing the cell counting, we can actually tell you if it's high or it's low. We'll actually detail everything out, give you the fungal bacterial ratio, which then allows you then to know what you are actually dealing with. And further, we actually do antibiotic resistance profiling. And so we're seeing highly resistant Staphylococcus is becoming bigger and bigger. And so in the antibiotic resistance profiling, we will give you sorted by first tier, second tier, and third tier. So they're just listed right here. And what does that mean? Well, you want to be good antibiotic stewards. So you always want to move to the more common antibiotic first. So in this particular chart, for example, metronidazole, which is very commonly used, is right here in the first tier group. And if for whatever reason you can't use something in the first tier, then you can move to the second and you can move to the third. We also provide suggested dosing for that patient as well. So we're giving you a lot of useful information here. In addition, in our relationship with RX Vitamins, we actually list out a lot of the RX products that are appropriate for this patient. So for example, they make a great Ultra EFA, list out the product as well as the dosing, colostrum, which helps attenuate the immune system, vitamin D3 should you have run it, which, by the way, I'm going to highly recommend that you do, because it does have a key role in the innate immune system and hence allergies. A lot of these patients are deficient or insufficient, and we'll provide you dosing on that. And they have a wide range of different topical shampoos and agents to help deal with antibacterial, antifungal, to alleviate a lot of these problems once we've identified them. So this is the new Atopy and infection panel from VDI, something new, I think, for your toolkit. May not be appropriate for every patient, but I think that you're going to find that it might be very useful in many cases. So I thank you, and I look forward to our next chat.